And here's the best part, and you know this, but maybe you guys don't. Your liver regenerates every 3 years. So my liver is 3 years old, and your liver is 3 years old. And so was this man's liver at 100, was 3 years old. Welcome back to another episode of Beyond the Bedside. I'm Betty Long.
I'm Rebecca Czarkowski.
And together, we are guardian nurses, and we have thrown you a curveball because we switched up our room where we're recording this. Today is St. Patty's Day, so I am wearing green, and you're not.
I'm not, but happy St. Patty's Day to all you Irish folk out there.
No, everybody's Irish.
Oh, everyone's Irish on St. Patty's Day. Silly me.
So we are coming today with an interesting topic. We are going to talk about good things in healthcare, or what we think are good things, or good topics, or celebratory issues that we have heard about and want to share.
Yes.
Because God knows
we don't often get to do that.
We don't get to do that very much, and actually there doesn't seem to be a lot of good news of late.
No, there isn't.
So it's nice to
So
share.
it was fun. It was fun to look for good news,
right?
to talk about it, and now to share it with you.
Right. So the first thing I want to share, I do have a little plaque.
This is cute.
I do want to share, for last several years, Guardian Nurses has been a sponsor of a girls softball league in the area where our headquarters are. And this year we got a plaque that says special thanks to our sponsor, Guardian Nurses, and there's some pictures of 5 very fierce looking softball players who probably or maybe they're 7 to 9. So we are going to hang this proudly in our headquarters and remember that everybody starts as a little 7-year-old, little athlete.
So cute.
So anyway, so
I'm excited for that.
That's good news.
Yeah, that is good news.
So, all right. So do you have any good news?
Well, I have good news, but do you have good news?
Yes.
Give me some.
Well, there's a couple things that I found out. The one is that the smoking rate in 2024 went down. It was previously running at 40% of the population were smokers, which is a lot of people. And when you think back when the days when you could smoke anywhere.
Everywhere.
Right. And now it's below 10%.
I saw that, Betty.
So probably because of the fact that smokers can't really easily smoke.
Correct.
I remember the days when I was starting in the hospital.
Oh, there were smoking rooms in the hospital.
Smoking rooms.
Yeah.
And the nurses would go back into the break room to have a smoke. And I was like, wait a minute, why am I not smoking? People are getting more breaks.
Yeah. Yes, I used to think that all the
It's like,
time.
hey, Betty, can you watch my patients?
I'm catching a smoke.
Okay, sure. Well, wait a minute. Why am I out here?
I'm going to smoke.
Right.
I want to smoke.
I want to take up smoking. But that's because of that, and probably because of obviously the poor health impact, the impact on health overall, hopefully. But I do think that there are some caveats to that statistic.
Yeah, because you said good news, and it is good news. No, it really is good news. It's below 10%. That's the first time that's ever happened. One of the reasons it is below 10% is because of vapes and e-cigarettes, which have provided an alternative to cigarette smoking. So a couple things I looked into there, though, because I don't want to be all grim, is we're looking at 2 different groups. We're looking at children and then over 18.
Okay.
And so the average, the remainder of this 9-10% of cigarette smokers are sitting between the ages of 45 and 60, which would make sense, right?
Okay.
Based generationally on when we knew what we knew. And unfortunately, on the opposite side of that is our e-cigarette and vapes, which are under the age of 18, has seen an increase, although it has been flat for the last 2 years. So it hasn't gone down, but those numbers also haven't gone up, which is encouraging. But I think it was 40% of middle schoolers said that within the last month they have had some of a vape or an e-cigarette. Middle school.
I mean, when you think about it, they're flavored, right? They're
Right.
making it very
And
attractive.
fun.
right, and
packaging's
fun,
cute.
and other kids are using it, and the cigarette community or cigarette industry, I guess, is going to lose an entire market of people if
They don't find
other,
something, right?
find other.
So, when you look at e-cigarettes and vapes and kids, let's talk about just the kids. Some of the, before we talk about kids, another
This is
positive.
supposed to be about good news.
It is positive. I'm going to give you more positive before I talk about like the kids. So the positive news is that secondhand, when you're talking about like secondhand smoke, when we're talking secondhand e-cigarette or vaping, 90% less of the impact from the chemical with an e-cigarette or vape if you are in the space of somebody who is utilizing one of those.
Right,
that's a big deal.
Because think about it. My mom smoked, right?
Yeah.
I don't know if your parents
Oh
smoked,
God, my mom.
And my mom wasn't going outside to smoke.
No.
She was smoking in the house.
Right in our
and
house.
we all breathed it in.
Even
Like
like
bars,
restaurants, you could,
right.
like, as an employee of a restaurant, you could just sit up at the bar and smoke your cigarettes while you're folding your napkins. And buses, subway, like not subways, buses. Did they have smoking? I know trains did.
Yeah.
Except a train certainly had a smoking car. Planes, you could smoke on a plane.
Right.
Casino, like all the things that you think about in your life where you were like trapped in that little cell of smoke.
It's a wonder that everyone doesn't have
I know.
cancer.
I know.
Right? Because
It's crazy.
it is a carcinogen. Well,
So I do think that the secondhand vaping is a definite positive. So we should see, when you're talking about smokers' cancer rates hopefully coming down, secondhand cancer rates should also whenever they're going to do these studies. But that I thought was super encouraging. When you're talking about the peer pressure though, from that perspective of high school and middle school, in particular middle school, I think it's important, I say as a parent, it's really easy to say, don't do it.
Okay.
Right? It's easy. It was very easy to tell my kids don't smoke. Why? Right? So we've established lung cancer with cigarettes, and that's a pretty well.
Oh, besides all the other cancers, it's a risk factor for
other cancers as well. Yes,
right.
Correct. But I don't think they fully understand the risk with vape and e-cigarettes. All we're telling this younger generation is don't do it. It's bad for you. Don't do it. Don't do it. Don't do it. Don't do it. But if you're going to market it for them with great colors and fun packaging and they taste good, certainly not tasting like a cigarette, I don't think.
Right.
Different flavors to meet your preference. It's really important to be able to share with your children the consequences look different than cigarette smoking, but there are consequences because it's a vapor, it's not strictly water, right? And it has chemicals in them. So, and nothing is organic, nothing is clean or out of the ground or anything like that. If you go back into your brain with smoking, it was the added carcinogens that really created the issue with cigarette smoking, right? So establishing kind of the why, really educating yourself if you're speaking to middle schoolers or high schoolers, it's not a directive at this point in time. I think we've kind of lost that battle. It's about here's what you're risking by doing this and sharing with them what it might look like for their lungs. Because cancer is just one of the many things that can happen.
Well, and also you have to combat the social media postings that make it so much fun, and because that's where they're getting their information. Their parents can do what they can do, but at the end, they're going to spend hours on social media and peer pressure, social media, same thing.
Yeah.
So speaking of social media, I have some good news around that.
We like that too.
Okay, so there was a report of 3 teenagers who did a pilot to try to minimize their screen time, right? They wanted to voluntarily do this to see if they could minimize their screen time. So they all tried different methods. One was a physical block on the phone. Another was a piece of software, an app that was voluntarily downloaded onto their phone, which kind of told them how much time. And the third was changing the color on their smartphone to black and white, right? So I have done that myself, and it makes it really less appealing to look at your phone, to open it up. And the 3 teenagers all found themselves with better They had more interactions with their family. They were reading. It's like, look at you. So that the pilot was a positive result. They all felt like they got more time with hobbies, with their family, better sleep, more interaction with their friends that they weren't doing so.
Interesting.
But here's the thing: when they talked about the amount of screen time that they spent, it was an average of 4 hours to 14 hours, which blew my mind. But they said most of it is done at bedtime, when after they probably say goodnight to their parents and they're on the phone for 4 hours just mindlessly
Scrolling or watching a show or
looking at TikTok or something. So I thought that was good news. And I know that there are schools that are putting in place restrictions, put their phones aside when they come into the classroom. There are schools that are saying no phones. So there's an effort.
Yeah.
There's an effort to minimize screen time.
The 3, and you might not know this, the 3 that did this study, is there like a post follow-up with them? Like, did they return back to their hours of use?
That's a great question. I don't know, but I know that I've had some friends who have, as a result of reading about it, because I shared it with them, they've taken the phones away from their kids when they go into the bedroom.
Oh.
And that's one of the methods that the kids use, is to not take it into the bedroom.
Mm-hmm.
So
I do that.
you take it, you leave it outside the bedroom? Yeah. So I don't. But I'm not looking at TikTok either.
Right.
I don't even have TikTok on my phone. And I'm not a great social media scroller either.
No, I stopped. I've really found myself not really interacting that much anymore with social media.
And people become indignant when they're like, I sent you something on Facebook. And I'm like, I'm sorry. I don't look at Facebook. Maybe once, twice a week.
Yeah, I found I told you this, a message from my family member, very distant family member who was inquiring about a family member and sent me a message on Facebook.
Right.
And I hadn't been on, honestly, in weeks. It was horrible. And then I go on and I check it and I'm like, oh, I feel horrible. I guess they didn't have my primary number to call me. But really, I don't go on that often anymore, just because.
Yeah, I go on Guardian Nurse's page, I go on LinkedIn,
Yeah.
I go on, but for...
You're not like sitting at home going, wee.
No. Wee.
That is good news.
Okay.
That makes me happy. It makes me happy that they figured out that there was some improvement to the quality of their life when they removed it. That they were willing to admit that.
Oh, good point.
Because I don't know if I were in high school, if I'd be so quick to be like, yeah, it was much better because, oh gosh, what does that mean long term? But I appreciate that very much.
All right, so another piece of good news, I think. So I get an email every day from a listserv, I guess, or an email listserv called Nice News. So it gives me all this great news, nice news, positive news, and I enjoy reading it. You could sign up yourself. But they had an article about the oldest organ donor in the United States was 100 years old. Wait for it. This man was a World War II veteran. He was a guard at Nuremberg, at the Nuremberg trials. I had just watched that movie, Nuremberg.
Yep.
Very good.
That's old.
Oh, is it?
No, I mean, he's old.
Oh,
if
he's
he was
old,
doing
right. So, right, the movie's not that old. And he was a cattle farmer in Nebraska when he came back. He was married to his wife for 72 years. Great American, citizen, right? But he developed a bleed in his brain, and his family, he was on life support, and the family decided to donate his liver.
Wow.
And here's the best part, and you know this, but maybe you guys don't. Your liver regenerates every 3 years. So my liver is 3 years old, and your liver is 3 years old. And so was this man's liver at 100, was 3 years old. So they donated his liver before he came off life support.
I love that.
And the person who got his liver left the hospital in 5 days. And right, that's a great.
That
It's
is
good.
great news. I love that.
Yeah. So I thought that was really kind of a good, great. The family decided
Oh,
to
and
do
did
it.
the families like connect at all? Did they say?
No, they didn't talk about that. They just talked about that the family, his family as a unit, he had always been helpful in his life. He was a solid citizen, right? Heartland. And then his final act was to donate his liver.
I love that story.
Isn't that cool?
Yeah. Well, the liver is amazing that way. Like it really does truly rejuvenate.
Yeah.
So
But I didn't realize it was
like
ever.
so me either. The 3-year thing, like
Right.
we're all
So-
the same age.
Liver-wise.
Liver-wise, yeah. That was good news. Okay, I have good news.
Go ahead.
I have what I think is good news. So there is a new screening to identify pancreatic cancer earlier.
Oh,
That's a big deal,
that is
right?
Yeah, that is a big deal.
So again, I did a quick read here, but there were two measures or markers for pancreatic cancer, and both of these markers were great, with the exception of, is it going to identify super early cancer, right? Or are there false positives, false negatives? So this was done at University of Pennsylvania, I think I said, right? The pancreatic, and
trials, right.
yeah, it was University of Pennsylvania and maybe Johns Hopkins, and they have found these 2 other markers when combined with the 2 existing markers. I think it was like 87% of stage 1 and 2 pancreatic cancers are identified with these markers. Now, you're not going to get the markers without symptoms, so I don't want this just anyone to pull away from this like an opportunity to see if you might develop pancreatic cancer. That's not what I'm insinuating. But one of the problems with pancreatic cancer is it's very hard to identify early, and symptoms usually appear as you've been further along in that. But to be able to capture pancreatic at a stage 1, stage 2 changes likely the trajectory of life expectancy. Not yet, as they move forward with this initiative, with
And
this.
this is a blood test?
Yeah.
Blood test.
Yes.
So it's easy. So, But you
Yes.
have to have some symptoms, because I think
something that would lend them to.
Because that, to your point, pancreatic cancer, when diagnosed, is often stage 3 or stage 4.
And I think it said like the CA19 and the other marker, I'm forgetting what it is off the top of my head. Part of the issue with using them for early pancreatic cancer is one of them lights up even for pancreatitis. Right? So it's kind of like a PET scan. You get a PET scan, used to be for cancer as a good solid marker, and now what they have found is if you've had any injury to anything, you're going to light up, and then you're spending time deciphering what is considered might be potentially cancer versus an old injury, old head injury, an old this injury, some type of bruising or swelling or event that happened, it will light up. And I think it's the same type of thing here.
Listen, I think the next, what did they say on Star Trek? The next frontier is going to be genetics.
Yes.
For sure. Especially in cancer, because it's already happening. Immunotherapies are coming into place where some cancers are a chronic disease, but to be able to identify them sooner because of that, the science behind it, which little commercial, we should fund science and clinical trials and all those things. But that's good news.
The genetic testing to me is definitely the wave of the future. It's getting all the players on the same page. So right now, the insurance company, the payers, the hospitals, the providers, everyone that's involved in care. So when you get right now, some of these genomic genetic tests you can do to see your predisposition or your risk to developing cancers, yada, yada, yada. And so let's say you get one of these blood tests through work. Let's say it's covered at work, and it comes back and it says, yes, you are showing that higher risk of colon cancer, let's say. And then you're 22 years old, you're 29 years old, you're 35 years old, and now what do you do with that?
But they shouldn't be testing 29-year-olds, 35-year-olds.
If you can pay for it, you can get the test.
Okay, good point. We're sticking with good news.
Good news.
Good news.
You're right. I don't know. I'm sorry. We'll come back next time.
Yeah.
Not good news.
Reel
it in.
Back it up.
I just think it's important to recognize there's so much
We can talk
great
about that later. We can talk about
advancements,
another
and
episode.
we haven't caught up yet. How's that?
Uh,
Science is here, and then the processes and getting it all covered and all is still down here.
Right.
And
the
we need to
insurance is
meet.
down here.
We need to
Yes.
meet, because ultimately it's saving not just a life, but the earlier you catch cancer, obviously the less
Less
expensive it's going to be. So in the commercial world, like, or Medicare or any insurance world, it feels like it would behoove whoever, but there's still like that break, the disconnect between the science and best practice, in my opinion.
Well, your opinion matters.
Thank
At
you.
least here it does.
Oh, thank you.
You're welcome.
Appreciate it.
Okay, that ends our good news session.
Good news.
Right? There's
Patty's
more
Day.
good news. Baseball season is opening up, so we're excited. Yay. Right?
Yeah,
be fun.
9 days.
It'll be fun to watch that, and maybe the weather will get nicer so that they'll actually be playing baseball in the spring. But who knows? Because the weather has been brutal in the Northeast, at least in the Northeast United States. Thank you for joining us, and do not forget to subscribe to our podcast and to join us next time on Beyond the Bedside.
Bye.
Bye.